pretty similar to a pacemaker for the brain. It delivers an electrode pulse to the brain when it senses abnormal activity and kind of stops a seizure in its tracks.
We were the first center in South Florida to perform neuropace surgery, and one of very few centers in the United States that's able to provide such treatment for patients with intractable epilepsy.
These are patients that have been taking 10, 12 medicines for years without much result.
It's a small device that's battery powered that will be implanted in the skull.
It records the electrical activity in the brain, the EEG, when the seizures are firing.
It will detect any kind of a change in the brain activity and any sign of an early seizure that might happen at any time, and will be able to generate a stimulation to this area where the seizure might be coming from to terminate or stop the seizure before even it happens.
They don't feel anything. They don't even know what's going off, but it's an impulse that gets delivered to the site where the seizure starts and it stops in its place.
It's a very non-invasive surgery that require a lot of planning. We use a microscopic technique to put and place the leads on the epileptic focus.
When we're done, Dr. Zachariah is in the room and he's taking measurements.
In the surgery, we used EEG recording to be sure that everything is working fine, so we were able to record the brain activity. It really not only treat patients with seizures, but also it helps us to know more about the seizures, try to understand how often they are happening, what's causing them, and what's the effect of the medication on the seizures, and also how the stimulation works to stop the seizures.